So I am cardiologist at Jaunpur. I am having my own hospital there, RB Memorial Multi Super Speciality Hospital. I am not at all a diabetologist, but I have got a privilege to write a book on diabetes, the new concept of diabetes. It's the Amazon best-selling book of 2025, and I am an active member of Diabetes Mission, Diabetes Free India. Also, I am working about it. My only question is to you. It's all right, it reduces weight, but it also reduces muscle. That is also called Ozempic phases. That is, it's not that actual platform to tell. So what about how to correct this Ozempic phases? And one more question to you. Can it be given to diabetic gastroparesis patients? Or why it is not given to type 1 diabetic patient?
First question, you said associated sarcopenia. Sarcopenia is accompanied in all patients who lose their weight, whether it is a diet restriction, whether it is fasting, whatever method you follow, there will be sarcopenia because obese people will have more muscle mass. That's very true. And if you lose weight, the muscle mass also reduces. And in patients who lose significant weight, around 20 to 30% loss is attributable to muscle mass. So loss of muscle mass also contributes to decrease in the body weight. That's a very common thing to work on. But if we take care of two things, one, if we increase the protein intake, which is usually reduced because of loss of appetite. So if we improve the protein intake or even maintain the protein intake, that will help in reducing this sarcopenia. Second, if you do good exercise, that will also help in reducing the sarcopenia. But it will always be there, and some degree of sarcopenia may not be that detrimental overall. Because these people who are overweight have also got their increased muscle mass. Once they reduce weight, they do not require that much of muscle mass. So it should not be a big concern that there will be sarcopenia in these patients. And if you take care of, by doing these two measures, you can reduce the incidence of sarcopenia in patients who are on this kind of therapy, with regular physical activity and protein intake. That's the one thing. Ozempic phases, as you said, is very right. It is commonly seen described because people lose weight, they lose also the cheek fat. As they lose the fat elsewhere in the body, they
Constipation, serious GI disturbances like constipation and diarrhea and this
those side effects are actually
dysgeusia.
I say that it's not a side effect,
and all.
it's the effect of the medicine. If it is there, it is the effect of the medicine and we can reduce the dose. It is not, truly speaking, it's not a side effect. We expect that there will be diarrhea and reduces the gut motility, so there will be some. However, those who can develop ileas because of some problem in the intestine, that may be a serious risk. So we have to be very careful in prescribing these medicines to those who have GI problem.
Can it be given to patients who are below 18 years and above 65 years?
No, it is not approved for treatment of obesity in children. However, they are going to have it up to 12 to 18 years, but then childhood obesity, but then that will be next indication. Right now it is up to 18 years.
Thank you so much, sir. Thank you.
And
About that, because this Ozempic injection is we are writing it right from 2018. It's now it's 2026. So lot many patients used to complain about this Ozempic phases.
We call it Ozempic phase, but if you explain to your patient that you are going to have some degree of fat loss of the face, and there will be some change in your face, which will be accompanied by the change in the fat of the abdomen, which will be a very good thing to have. And this kind of face, if you have any concern, I think you should sacrifice this much of fat, because you are going to have so much benefit. So that is not a serious issue. And maybe some people may...
But the dropout rate due to aseptic faces is very high.
I think let them have their life in obesity all right. Because if they want their face not to be changed, the time said...
It is freely available at Amazon and Flipkart also. I am the author of that book.
Okay, the audience should know it, that Dr. Sahab has been so prolific.
And it has been inaugurated by Medanta Chief Dr. Naresh Trahan at New Delhi, and second inauguration by Dr. Dinesh Singh. He is DM Jodhpur now. Okay. Thank you.
Good.
We
should have
I am
written by somebody, our colleague.
I am not a diabetologist.
No,
That's the. Thank you, sir.
Any other questions from the gynae?